Welcome everyone to today's hearing. We have a very full agenda and a very large crowd of visitors. And I want to start with the rules and expectations of conduct during this hearing. Everyone will be treated with respect and must treat all others with respect. I will not tolerate outbursts, shouting, clapping, or waving or holding signs. The support and opposition will each be provided the opportunity to have 3 witnesses to speak, and each witness has 15 minutes. So 5 minutes. So it's 15 minutes total. Otherwise, we'd be here tomorrow. Everyone else who wishes to be heard may only state your name, city you are from, and position on the bill. This will occur during public comment, and no other discussion or comments will be allowed at that time. This committee will focus on issues that are within our jurisdiction, such as the role of schools in providing a safe and appropriate educational opportunity for each student. We will not be discussing vaccine safety. That was discussed last week in the Health Committee. This bill has also been referred to the Judiciary Committee, where legal issues will be examined. Many other committee hearings are taking place this morning. Members of this committee may have to step out to attend another hearing. SB 277 will be the first order of business. A vote will be taken, but may subsequently be placed on call to allow absent members to cast a vote. The final vote may be at the very end of the hearing. Those not in attendance today can view this hearing live at calchannel.com, which also archives hearing videos for later viewing. So with that, we welcome the authors of SB 277, Dr. Pan and Dr. Allen. Mr. Senator Allen.
Well, thank you so much, members of the committee and members of the audience who are here today. I just want to start by thanking both the supporters and the opponents of this issue, this bill, for their thoughtful questions, comments, and analysis of the legislation. Also, the members of the Education Committee staff who put extra effort into planning this hearing and ensure that every voice will be heard. From every angle of this legislation, we thank you. Today I'm here to present SB 277 with my joint author, Senator Pan. And as I've mentioned before, in many ways I'm here because of my father. He's had a great life. He's an incredible man. He also has polio. He got polio when he was a little kid. He got it right before the vaccine became widely available. He doesn't even have the arm strength in his arms to be able to break his fall. When I go down to my district and I talk to folks from his generation and older, I hear a story every single time about the horror stories of communicable diseases, from measles to polio to other diseases that left people dead, left people maimed, left people permanently harmed. And it's what brings me to this experience today. I think that many people have forgotten the extent to which we have become a victim of our own success, given the fact that we have such high immunization rates that's protected us. Measles, of course, was eradicated in 2000 by modern standards, and now, of course, we're starting to see it come back.
Senator Allen, I'm going to ask you to pause for a moment. We have a quorum, so I'm going to establish a quorum. Please call the roll.
Liu?
Here.
Liu here. Huff? Block? Here. Block here. Hancock? Leyva? Here. Leyva here. Mendoza? Pan?
Here.
Pan here. Vidak?
Here.
Vidak here.
Thank you.
Absolutely.
Please proceed.
So here we are at the Education Committee. I came to this experience in the Senate as a former school board member. I served on the school board in my hometown. And we had relatively low vaccination rates, and parents were coming to me, coming to members of the board and saying, what are you doing to protect our kids in our community? And then lo and behold, we had this outbreak. We had to quarantine our child care facility at Santa Monica High School. We had to quarantine our baseball coach because of a measles outbreak. And at the end of the day, people in my community shouldn't have to worry about these diseases. We vote for higher immunization rates. That's why we're here today presenting this bill, and we look forward to a thoughtful and robust discussion. Thank you.
Thank you very much. Dr. Pan.
Thank you, Chair Liu and Senators. I'm pleased to join author SB 277 with Senator Allen. SB 277 was heard in Health Committee, where it was established that vaccines are safe and efficacious. Vaccinations have prevented more than 21 million hospitalizations and 732,000 deaths among children born in the last 20 years. In fact, every leading scientific, medical, and public health organization across the world all support vaccination as the safest, most effective means of halting serious contagions such as measles, whooping cough, polio, and many others. And evidence shows that the disease being prevented is at least 1,000 times more likely to cause a significant problem than the vaccine itself. Our vaccine efficacy is not only the result of direct protection from receiving the vaccine, but the protection afforded when a sufficient percentage of people are vaccinated. For measles, that would be 95%, to prevent the disease from spreading throughout the community. And that is why every state in the United States, including California, has passed laws requiring vaccination for school entry to protect children and the community. However, recent events such as the measles outbreak that began in Disneyland last December has proved that our community immunity is waning to dangerously low levels due to over a decade of increasing use of the personal belief exemption in too many schools. For example, in 2008, an unvaccinated child infected with measles in Switzerland brought it back to San Diego, where measles spread to 11 other unvaccinated children. However, that disease did not spread further because there were sufficient vaccinated people in the immediate community to prevent further spread. However, recent events show that California is losing this protection as the number and size of places with significant numbers of unvaccinated people in the state has grown each year. In fact, the pertussis outbreak in 2010, which infected over 9,000 people, hospitalized 809, killed 10 infants, and the Disneyland measles outbreak, which infected 134 Californians, including 15 infants too young to be immunized, and hospitalized at least 20 people, have both been linked to communities with low vaccination rates and high use of the personal belief exemption. That is proof of why SB 277 is necessary to protect the public and our schools from vaccine-preventable contagions. In SB 277, parents will still decide if their children will be vaccinated. However, that choice demands responsibility. Parents who decide not to vaccinate their children will no longer be able to exempt them from legally required vaccinations when enrolling them in the school attended by other children, but will instead have to homeschool them. SB 277 retains a medical exemption for children for whom a licensed physician determines cannot receive a vaccine. And these children who cannot be vaccinated depend on other children at school to be vaccinated to prevent them from preventable contagions. In addition, infectious outbreaks disrupts education and harms students and staff in school districts when schools have to be closed, students fall ill, or are quarantined at home for weeks to halt the spread of these diseases. Parents demand that their children are safe at school, and school districts and the legislature often adopt requirements on students to assure that safety. And that is why, in addition to the support of many health organizations, SB 277 is supported by school boards, school employees, school nurses, and parents, and school districts ranging from Los Angeles Unified to San Francisco Unified to Reunified and many others. To testify in support, we are pleased to have leukemia survivor Rhett and his father Carl Krawit, polio survivor and former nurse Ramona Garcia, Sacramento City Unified School Board member Jay Hansen, and also present will be Dr. Randy Bergen, Chief of the Outpatient Pediatric and Pediatric Infectious Disease Consultant, who's here to represent Kaiser Permanente, who's here just to answer technical questions. Thank you.
Thank you very much. I'm sorry.
Madam Chair,
Yes.
I'm going to be here. I'm also chairing a committee this morning, so I'll be back and
Yes.
forth as much as I possibly can.
Okay, thank you. In support of the bill, please. Press the red button and introduce yourself by name.
Good morning, Madam
Good morning.
Chair, and members of the Health Committee.
Education Committee.
Oh, excuse me. That part wasn't written. Members of the Education Committee. I can learn
Change your
something.
script, right.
My name is Carl Krawit, and I respectfully will yield 1 minute of my 5 to my son. SB 277 is a commitment to the health and safety of the citizens of California, especially the most vulnerable, like our son Rhett, who battled cancer for 3.5 years. In 2010, our son was diagnosed with leukemia. He was so sick that the doctors described it to us as between a rock and a hard place. His cancer was very serious, and he had serious infections that delayed his chemotherapy. We were in and out of the hospital for 3.5 years. Our first interaction with trying to ensure high immunity rates at school was when our daughter entered kindergarten. Rhett was home from the hospital. We addressed our concerns with the staff at Reed Elementary School because he had a weakened immune system from chemotherapy. We wanted to make sure that if someone were sick in our daughter's class, she wouldn't bring it home that illness and threaten Rhett's treatments. The staff consistently worked with us to reinforce messaging about illness policies and educating parents about vaccinations. Again, we had the same conversations with parents and teachers when Rhett started kindergarten. At a parent meeting in 2014, we continued to pressure the school district to take action, citing the example of peanut allergies being given more importance than the risk of vaccine-preventable illnesses. When there was a chickenpox outbreak at Del Mar in our district, the message from us was consistent, and our school worked very hard to update records and educate parents. But it just wasn't good enough because we go beyond our school and our community. This year, when the school sent us an email indicating that our son would be barred from school for 21 days in the event of a measles outbreak, not only did we fear for Rhett's life and his health, but we worried about the impact on his education and our jobs. It was frustrating, infuriating, really, to think that Rhett might have to miss more school due to a vaccine-preventable illness because other families were choosing not to immunize. So was the idea that our family might have to bear the weight of the financial hardship of such a quarantine? Our family had already faced that strain that comes along when your kid gets cancer. Jody was out of work for over a year. 21 days is hard for us. We have jobs. And the thing about this is, happily, Rhett's doing great. He's healthy. He's in full remission. It's been 15 months since the end of treatment, and he's already started getting his vaccinations. It's not about him anymore. It's about all those hundreds of kids in chemotherapy, all those babies. We're so pleased you're taking on this issue. Our culture, through news stories and other kind of storytelling, emphasizes individualism to such a degree, it's hard for people to understand how it impacts others. That's easy for people who claim personal choice, but we're here for the community. We believe that this is sound public health policy because it keeps our children safe. You have a duty to legislate from solid evidence, not from fear, and keep our schools safe. Vaccines save lives. Please vote yes on SB 277. Thank you, and now I yield to Rhett.
My name is Rhett Crowett. Vaccines save lives. Leukemia is cancer in my blood. Cancer cells are the bad guys. For 3.5 years, I took chemo to get the bad guys out. I had medicine called vincristine, methotrexate, and 6-MP. I took steroids, and I had 24 Erwinia shots in my leg. Now I also had more than 50 surgeries to put chemo in my spinal fluid. Now I can say, gone with the cancer. Thank you for making sure that kids like me don't get sick at school. Please vote yes on SB 277 so that we can all say, gone with the measles. My name is Rhett, and I give a damn.
Okay. Others in support?
Good morning. I want to thank Madam Chair and the committee to letting us tell our stories. My name is Ramona Garcia. I'm 77 years old. And 70 years ago, I got polio. It has has changed my life forever. Excuse me for being a little bit survived by this, because I have to go through and live the whole thing again. I had a high fever in 1944. I went to a hospital in Aguilar. They sent me to a bigger hospital in Pueblo, Colorado. I had an emergency appendectomy, and I never got up and walked again for 3 years. There are many stages to this polio. There's the acute stage, in which I couldn't walk. I laid in bed flat for a year. And then that's the first one, the acute illness, and I had paralytic polio, the worst kind. The second stage is the recovery and the convalescence. I had to learn to sit up, to crawl and walk again. It took years. My parents took me to St. Louis, Missouri, to a Shriners Hospital. A very foreign area for me. I come from a big Hispanic extended family. It was very foreign to me. I did speak English, but the food was very, very different for me. The whole experience was different. I had to learn first to sit up, then I had to crawl, because you have to learn to walk all over and use your system. So I got over the acute stage, and I went on to stabilize. The second period is the recovery and convalescence. That took me a long time. The third part is the stabilization. I thought I had conquered this disease. I was doing fine. I learned to crawl. I used a wheelchair, crutches, walkers, and I finally learned to walk, and I got to go home after 3 years. But in 1983, I was hit again with post-polio syndrome. This is the fourth part of this disease. It's been devastating. You heard the co-author say his father couldn't use his arms. That's happening to me. I have very little use of my arms. But the biggest factor is it affected my ability to do the daily activities of daily living, such as walking, stair climbing, and dressing myself. So I have to have somebody with me during waking hours every day, 7 days a week. So I have to have somebody help me. This disease is terrible. It's preventable. Let's support this bill, because you don't want to see many of us again. There were thousands and thousands of people with this disease in the 30s and 40s. The iron lung. I saw many people in iron lungs. The children I saw when I was rehabilitating all were like me. We were all crawling, learning to sit up, learning to walk. I didn't get to see children in a normal environment, because that wasn't my environment for 3 years. I recovered, I went on, and I became a nurse. But I had to quit my job due to an injury and not being able to work anymore. So it's a devastating illness all through our lives. So I beg you, please prevent infectious diseases that are preventable. You know, it took us a long time to get the vaccine. Please support this bill. Thank you very much.
Thank you.